As Lion Health looks back on 10 years of care to the community, we want to reflect with some of our staff about the developments and steps Lion Health have made in order to adapt to ever-changing healthcare. On this site was where the Stourbridge Line Railroad steam locomotive was built in 1829. It was the first locomotive and the first foreign-built locomotive to be operated in the United States. Fast forward to 2012, after a number of years of being abandoned, the old foundry began renovations with the intention of being built as a medical centre for Stourbridge and the surrounding community. In April 2014, Lion Health was open to the public. Now, 10 years on, we ask staff how they believe Lion Health has changed over this period, looking toward the future.
So people ask about Lion Health and say, what a fantastic building you have. I have a slightly different perspective. What I would say is Lion Health has a sort of building that all primary care should have. Primary care is where most patient consultations take place and most patient care takes place. And as such, we should have more facilities in the community for the people of both Dudley and the country, like Lion Health, because that's how you make a real difference to people. How has Lion Health changed over the years? Lion Health has changed. If you remember back to 15 years ago, we were working at Worcester Street, out of Worcester Street Surgery. I've been working out of 3 different buildings on the same street, then 4 buildings all within 150 metres of each other, so clearly something had to change. So we've changed from a list size of 16,000 patients to a list size of nearly 30,000 patients. That has been the biggest change. So we've moved from being an organisation working out of corner shops to one working out of a big factory, and we're very proud of that. It's been a massive change for us all. A lot of people think it's easy working in a big practice. Actually, it's just different and difficult in different areas. So small practices have some challenges. We have challenges because we're big. What do I enjoy about working at Lion Health? The first thing I enjoy is I come in the morning, I'm proud of the building. The second thing I enjoy most of all is having a car parking space. And thirdly, I have a lovely room to work from with supportive staff, great reception team and a management team who try to make my job as easy as possible. How does Lion Health impact its community? I think it impacts its community in lots of ways. An observation, being brutally honest, would be, could we do more? Of course we could. I think that's our challenge moving forward now, is we have a secure and firm foundation. How do you make those real differences? Everybody who gets to see us is happy with their medical care. It seems a high quality medical care. And I think the important thing is to expand the amount of medical care we can actually provide from these premises. And that's our real challenge. So our challenge is to impact on our community by improving the amount of high quality care that we provide. I think one of my proudest moments of working at Lion Health was when we actually opened the building, and bless him, the Duke of Gloucester, who must be 103, came and opened the building, and even he was impressed with it. The day Lion Health started must be a proud day for all of us. I think the key development in changes in healthcare from my perspective has been the pandemic. So once we had the pandemic, we had to move from seeing everybody face to face to then seeing everybody remotely and a few people face to face safely. And now we have a hybrid model, which I think is far more suited to the modern population. So I think that would be a major thing for me. The pandemic has shaped the way that primary care has moved over the last 5 years now. Next 10 years, I think there's a lot of opportunities out there for Lion Health, but we've got to be brave enough to take them. I think we have a young team of doctors coming through who need to be allowed to flourish and develop and explore the opportunities that will exist. But I think the opportunities that exist will only come by being well organised, well developed and business focused. So I'm hoping over the next 10 years we can develop those areas to the benefit of, most importantly, our population and also our staff, whether they are medical, non-medical, but all those who work at Lion Health. I suspect primary care is going to get more diverse. I need to embrace that rather than try and stay the same. If we stay the same, we won't make the progress we could do.
Since I've been at Worcester Street, it's got a lot bigger, a lot better in some ways. The new building is a lot bigger, a lot brighter. I think it has changed for the best, as in with all healthcare.
I've worked here about 6 years after being over from another surgery in Norton, where the GP is retired. I came from a lot smaller practice, only 3 GPs, whereas here we have an extensive number of GPs. The appointment system is varied, but it is more challenging here, but I enjoy that. All of my colleagues know different things within the office, so it's nice to be able to share our knowledge, and we are lucky in that we all get on well together.
What do I enjoy about working for Lion Health? The people, everybody that I work with, makes the job much easier to do. Proudest moment working at Lion Health, learning to do the secretary job. It was actually a lot more complex than I thought it was. How do I think Lion Health has improved over the past year? The phone system, even when I was on reception, was like rudimentary, just to fill the job it had to at the time. I think it's become a lot better, easier for us to use and easier for other people to understand who are calling in.
I think that Lion Health constantly tries to change for the patients. 3 words that would describe Lion Health: it's professional. We work to national guidelines, standards, very supportive. We're supportive of each other. The multiple roles that are within Lion Health: doctors, nurses, paramedics, physicians associates, admin staff, management, all the clerical side as well. I'm really sorry if I've missed anybody out, but everybody's supportive. We all have a good sense of humour as well, and I think that's important for a workplace. We all get along, and that keeps you going as well. The staff are all lovely. I enjoy having my own autonomy, visiting patients. As nurse practitioners, advanced nurse practitioners, we can prescribe within our competency whatever the doctor can prescribe, and that gives us responsibility and keeps the job interesting and to a level that's challenging but enjoyable at the same time. I think under immense pressure, and especially even worse over the past few years, that we always do our best, always put the patients first. We get an awful lot of compliments that aren't seen by everybody, and we're grateful for every single one, and it keeps us motivated and want to keep doing what we're doing. Benefiting the patients, making them feel better, being there for them makes me proud all the time. Doing the job I do makes me proud, because I feel like I am making a difference. And when somebody is so grateful to you because you've supported them and helped them, then I'm proud all the time for that. There's been some big changes. We've got new staff that make a difference. We've got communications now that make a difference. I think the communication is getting better. I think we're trying to reach out to the public. We're doing more informative YouTube videos and the website and the Facebook page to let the public know what we are doing and what roles we've all got, because there are multiple health professionals within Lion Health that people may have never heard of before. So I think the communication between us and the public is getting better as well. People accessing us, we have had a lot of positive comments over the past few months on how access has improved, how they're not having to wait as long. There's no denying we've struggled under the pressure, but we are seeing positive moves, especially over the last few months.
I joined Lion Health in October 2020 during the midst of COVID. And since then the practice has had to evolve and change quite dramatically, obviously, to work through COVID and then the after effects of it. So we've had to adapt the way we speak to patients, the way that we contact and deliver the care to our patients. So that's probably been the most dramatic thing that's changed. And I think it's been, made us a more efficient and more effective team. So there's been some real benefits from the pressures and the changes that COVID have made us put in place. Because we're such a big practice, there's a real good team ethos, and it's nice working with lots of really great colleagues, and that means that throughout the pressures and the stresses of the work we do, it's nice just having that really supportive and close team around you, because it makes the job far more bearable when you have the pressures from day to day.